It then kind of evolved into the rest of the hospital, not just
Okay.
patients who are critically ill, but those who are sick enough to be in the hospital, need hospital care, but aren't well enough to be at home. So you have a different level of care, different set of problems. And then several years back, I opened this office and became a primary care doctor. So,
Yes.
um, yeah, I do have that unique view of all three levels.
Las Vegas, Las Vegas, Las Vegas. How are you guys feeling? And how is everything? I hope you guys are getting rest out there. I went by on North Las Vegas the other day, and I didn't notice that the Texas is gone. It just looked flat, and I was like, "Wow, the Texas is just gone," and I missed the whole process of it. But death to one casino and the birth to another one. We can't wait to see what the Durango is looking like, which is on the southwest side of town. So that's real exciting to see. Now, whether you're traveling back and forth to Las Vegas or a local residing in our beautiful valley, of course, safety is first. We symbolize that by providing sufficient healthcare services and facilities. There's at least one or two hospitals on each side of town. We have urgent cares on every corner, but the key is quality. Now, when searching for a primary care physician, you search for trust, confidence, empathy, love, and community. My guest provides all quality at his practice. I welcome Dr. Shaun Jang, owner of Good Samaritan Las Vegas, and also the company president, Carolina Chavez. Thank you guys for joining me today.
Thanks for having us, Coyle.
Oh man, no problem. Yes. Hey, real quick, doctor, one quick advice. We were talking about this before the show started, and you were perfect to ask. Give us quick advice to business owners nowadays who think they can continue to function off 4 to 5 hours of sleep.
Oh, absolutely not. It's not just for business owners, but for patients with chronic illness. It's the first thing that I introduce to them. They come. A lot of patients come to the doctor thinking that they're going to get a pill that fixes their problem. Sleep, quality sleep, actually makes the biggest difference in the outcomes regarding chronic disease. And as a new businessman who's learning how to become a better businessman,
Right.
sleep is the most important thing for me. It's come to the forefront. I can learn how to do many other things about running a business. The hardest thing to learn is to get yourself 8 quality hours of
Right.
sleep.
That is hard. And they say I'm still trying to get the lingo. If they say you can't make up sleep.
And that's something I found personally in my own life. I'm 40 years old now and spent most of my life living on very little sleep. And what you find is that let's just even bring that into a smaller scale. Let's
Hmm.
say you don't get good sleep for 2 or 3 nights in a row. You don't
Mm.
get all of that back in one night.
Right, right,
It's
right.
gonna take you a week of good sleep to get your energy levels back to where it was before you lost those 2, 3 nights.
Wow, wow. Now, you're big on especially providers' interactions with the patients. I see that. Now, what sparked that focus? Was it experience?
Yeah, actually, it was. I actually have a very unique journey as a physician. I've not just spent my entire career in primary care.
Okay,
I started out as a physician who was what we call a hospitalist. We're dedicated to the hospital. Now, I came out of my residency training with a heavy emphasis in the intensive care unit. So
hmm.
the beginning of my career was in the intensive care unit. Um, it then kind of evolved into the rest of the hospital, not just
Okay,
patients who are critically ill, but those who are sick enough to be in the hospital, need hospital care, but aren't well enough to be at home. So you have a different level of care, different set of problems. And then several years back, I opened this office and became a primary care doctor. So,
yes,
um, yeah, I do have that unique view of all three levels.
love it.
And having a solid primary care doctor can save you a lot of trouble in the long run. So I spend much more time here in my office with my patients than I ever did with any patient in the hospital because it starts here. If I do my work well
Passion.
here, if
Yes.
my relationship with the patient is good here, if the patient buys in, if the patient feels responsible, and actually, that's a huge point of emphasis here at the Good Samaritan is I don't tell you what to do.
Mm.
We make that decision on how to make your life better together.
Mm.
I give you the information that I've learned through my experience, my education, my 10 years in practice.
Right.
But at the end of the day, if the patient doesn't really believe in what I'm sharing with them or doesn't, if they're not buying into it, if they're being told what to do, it
Right.
doesn't work. The compliance factor just
Right. Right.
doesn't exist.
Right. That's true. It's funny you say that because when I think about it, at my age, I've been in Las Vegas. It's going on 20 years, and I've been through for the 20 years four primary doctors, and I can probably remember the last two names. The first two I can't remember. There was no connection, and it's funny because I can remember back then, like my parents, and then also my grandparents, they had a connection with their doctors. It was old school. It was different. It's almost like they were part of the family. They even came by and everything. Nowadays, there's no connection. So it's when you speak on that, it's like, wow, it makes me think of those times when there was a true connection between that, physician and the patient.
It's really important. It's really important because the compliance factor, and I mean, there's studies out there, we can do studies on our own. Compliance goes up when the doctor knows the patient's name, when the doctor knows the patient's background, social situation. It's not just me, it's my staff.
Correct.
Carolina came to me and came to work with me, and she treats patients the exact same way. She knows them by name. She knows their children. She knows what they
Oh,
spent the last vacation doing.
right.
We we have these longer clinic times. Patients, and Carolina's probably going to kill me for saying this, but there are some patients that are really in need. I give them the freedom to come and sit in the lobby, come sit in our meditation room for a little while, come
Right.
talk to us. Even if I'm not charging them for a visit that day, it's not just Carolina, but the rest of our staff. They all feel that way.
Right.
Now,
Right.
I don't have one member of the staff who isn't willing to take 5 minutes of time to go talk to a distressed patient.
Wow. They're comfortable to stop by even if they don't need anything, just to stay high, or if they got a quick chat. That's real good.
Now, I mean, I'm in danger of, filling up all of our space here. But that is truly how we've done it. We have patients that come by regularly, just younger children that just are in bad, like
Right.
toxic and tumultuous homes that
Right.
want to get away for a little while. And they come watch TV in our meditation room for a little while.
Right.
Get off the
That I,
street.
what you're saying, what you're doing now is just a small thing to what you're capable of doing. Because what you're talking about is whole different from caregiving. That's well-being right there, where facilities and things for people to come. That's on a whole nother level. I want to definitely get into your service. Before, let's let the audience know. Give us a quick virtual resume. First, you, Dr. Shang, and then I want to pass it on to Carolina. Give us a quick background of you guys, real quick, before we get into the services.
So I like to state my age first because people never believe it, but I am 40. I've been practicing on my own for 10 years now, I think pushing 11. I graduated out of Loma Linda Medical School, Southern California. I did all of my residency there, and then I did my year of chief residency there as well. So I spent 4 years there in training. I did a year as a clinical professor there
Hmm.
before I moved down to Texas, and I worked for a company down there for about a year before I decided that Texas wasn't for me, and I moved up to Las Vegas. Um, got to Las Vegas in about 2015. Spent 4 years as a hospitalist working at Sunrise Hospital, which in my opinion is the biggest, baddest, and most capable hospital
Okay. Yeah,
Hospitals,
Sunrise.
I don't have the people don't have the best opinions about hospitals, but Sunrise
Right.
really is a good one.
Yes, they are.
And and then about 3 years ago, I just decided, I want to do medicine my way. I don't want insurance companies and hospitals and bosses to tell me how to take care of my patients. And I think this is truly a passion and a dream of mine and Carolina's.
Mm,
Carolina came into the company. Initially, I hired her as a administrative assistant,
okay.
and she just blossomed in months. And now she runs this company,
Wow.
and it's because
Yes.
she lives and breathes this.
Right. Passion.
Yes. So
Yes.
I'm originally from California,
Okay.
but like we were saying earlier, ever since I can remember, I'm bilingual. Ever since I can remember, being able to speak English, I was the one going to doctor's appointment with my grandparents and my parents to
Mm,
translate. I think that my experiences in the past is what, being here in Good Samaritan, we never say no to a patient. I
right.
know how it feels to be, for undocumented patients when they show up to the office, or they're just scared because they think we're gonna use their information, or their mind is somewhere else, being afraid. Therefore, when the patients come into our office and they speak only Spanish, they feel comfortable. And I know
Right.
how to talk to them too, because I went through that with my grandparents. I wish someone actually cared for them, not just here, to see how much the insurance is going to pay, or
Correct.
cash. Because most doctors' offices, it's what kind of insurance do you have?
Right.
They prefer if
Right.
you have a PPO insurance, or if you pay cash, you get better service, right? Right here, we treat everyone the same. Um, like I said, I came to Vegas 3 years ago.
Mm-hmm.
I knew I had to be here, but I almost went back to California, and that's when I met Dr. Jang through a
Okay.
mutual friend. He shared his vision, and that was the connection.
All
So, like he
right.
said, I was supposed to start here as a receptionist, but here I am running the office, and we know all of our patients, and I love it. I love it. This is my second home.
Second. So, where are you originally from, Carolina?
From Orange County, California.
Okay, California. That's good. Because I was about to say it's really rare for him, for doctor to find good people like you, passionate with a good heart. That's rare. It is. He was very blessed to have someone like you, to find someone like you to trust, to take the bull by the horns and run with it like you do. And my hat goes off to you.
Carolina is something special. I I've been hiring people for most of my life. 10 years, I've always been in management, hiring, firing, and I hate to fire people. I hate letting
Right.
them go.
Right.
But this place is a very protected place, and there have been staff that have come and gone that
Correct.
did not fit
Correct.
the spirit.
Right.
And even though we're short staffed, we're not going to allow anybody to work here that doesn't live and breathe this.
I
And
love it.
so that's the thing that patients say the most about this office is they feel that energy as soon as they walk in here.
Right, right. Now, audience is listening and says, okay, this office, these people, they sound great. Good Samaritan, you guys, Las Vegas, Nevada. Doctor, we're going to get into your services. I want to get to your services as if they were going to the website. The first one will be the IV therapy. You guys can go back and forth if you want to, or you take it. Let's go ahead and give us a briefing on the first service, which is the IV therapy.
IV therapy is something that we is probably the most developed program that we have right now. And so one thing I found as a physician is when people fall ill, the vast majority of the symptoms that they experience, let's just say you get a cold, cough and a cold, okay? There is a reason why the doctor tells you to hydrate. Because the flu or the virus that's causing your illness is really it's the dehydration, the volume depletion that really makes you feel sick. So, I tell people to drink tons of fluids. It's really hard. There's something called insensible losses. When you are sick, your temperature rises. Your mouth is open when you sleep. You evaporate out fluid. You're losing more fluid from your eyes being open. Your stool, you lose these things called insensible losses. And to keep up with that when you're sick, by drinking 2 gallons of Gatorade a day, it's difficult.
True. That's
so
true.
Dehydration in and of itself is really the biggest benefit of IV fluid therapy. Now, we also mix in cocktails, vitamins. Vitamin B12 is a great energy booster. Vitamin C is great for skin regeneration, for immune system. We have a glutathione infusion, which is it's a very powerful antioxidant. So it gets rid of free radicals, decreases inflammation. B12B complex vitamins, magnesium, electrolytes. So I'll give you a little concept of drinking free water versus Pedialyte. Okay? It's kind of the same thing as infusing free normal water, saline, versus a bag of saline that has a bunch of electrolytes in it. And I won't bore people too much with the science, but having solutes and electrolytes in the fluid that's coming into your body is a better hydrating tool than to drink free water. Okay, and that's a common misconception that people have is when I get sick, I need to drink a ton of free water.
Right.
Well, better than that would be Pedialyte, electrolyte. And even better than that would be direct hydration into your veins. So, how much do you know about the process of how that happens?
So for the therapy, that can be preventive, and I think most of those. I think a lot of people are more aware of being diagnosed instead of being aware of a preventive state. They don't, right. But a lot of people don't know or aware, like, you can take care of preventive things, even things you're aware of that you're feeling, you can get help preventing that. And I think that's not talked about enough. I think the only thing that's talked about is when you're actually there or when you let go or if you're in this last stage, but there's not discussions about preventive things like what you were just breaking down and discussing.
So touching a little bit on preventative medicine, that's actually the mainstay of what we do. Let's just say the most common function and patient visit we do is what we call an annual wellness visit. Okay, and I have patients come in as young as 18. They want to get their blood work done.
Right.
The annual wellness visit is something that the insurance companies consider to be so important. They reimburse that to you at 100%. There's no copays, there's no deductibles applied. And we run the full panel of blood work to catch chronic disease before it happens, or to monitor chronic disease so that it doesn't progress. So part of that blood panel would be to rule out diabetes, cholesterol, signs of heart disease, your kidney, your liver. Electrolytes are all in there. Your 3 cell lines that come from your bone marrow, your hemoglobin, your white blood cells, your platelets. All of these things are, and then there's a slight difference in what women get every year because they are more prone to certain different diseases and men. And then also there's little twists on it based on your age, right? As we age, cancer screening becomes more important.
True.
What we did find during a pretty scary statistic during COVID and the pandemic and the lockdown was after the world came back, the stage at which we were catching cancer was a much more advanced stage.
Wow.
What that means is that because we didn't have the prevention during the lockdown for 2 years or however long, we were in 1 year, 2 years.
Right.
Because patients, first of all, feared going to the hospital and the doctor, but second of all, almost couldn't we couldn't catch the cancers early on during that period.
Right.
And so after what we found was by the time we're catching them in 2022, 21, they're already more advanced.
Right.
They have a higher morbidity and mortality. So annual wellness, preventative wellness, this visit is so important, even for an 18-year-old.
Right.
Okay, we got 18-year-olds coming here and getting those.
You guys provide everything. You guys, they have school and employment, physical exams, checkups. You guys, management of chronic medical conditions, blood x-ray and physical exams. Anywhere where you will sit up usually for 2 hours and don't even get looked at, you can come here, get customer service, feel like you're at home. This is a good place right here. This is something that's not really talked about again in the community of Las Vegas, or we even aware it exists, that we have it available for us. That's
No,
crazy.
the people are used to the common way that primary care doctors practice. Just like you said, your doctor probably doesn't even know your name. You probably don't know
True.
his.
True.
And that's because they're trying to see 40, 45 patients a day. We have a very hard line on how many patients I'm willing to see. Of course, people with emergencies or other things, we squeeze them in. We take walk-ins depending on acuity, etc. But this place is not built with profitability at the top of our priorities. This place is built because we want to do a service to the community that's
Beautiful.
actually effective.
Now, real quick, you guys do at the bottom have more than primary care, which you do have the home health care, medical and surgical, exercise and wellness, and pharmaceuticals. Brief us on services.
Yeah, I'll give you a little bit of, and this kind of goes back to my background. Patients who are out there that are listening, that have been in hospitals, that have been transitioned to rehabs, skilled nursing facilities, there's many levels of care. Even home health in the home, nurses going out to the home, therapists. I have experience in every single one of those, and I know how insurance companies work. So as a guide, I actually consider myself a guide that can help you navigate the healthcare system. I don't just treat a cough and a cold here and say goodbye, see you next year.
Right.
Patients call me when they get to hospitals. They say, hey, this is how I feel, this is not going right, and I can guide them through that.
Yes.
And we do that just because that's important. We don't get reimbursed for that kind of time or that service. We do it because patients need that.
Correct.
This city is full of elderly patients who have 10 different medical conditions and are on 15 medications. Well, they really have a hard time navigating the healthcare system.
Right. Now, there was one more thing on there that really struck us when we looked on there. I know the ladies was on. It was the LV Community Free Women's Defense class that you had.
Man,
Let us know about that.
I would love to. Listen, earlier this year, I decided to take control of my own physical condition and get into better shape. Actually, that's been about a year now.
Okay.
And I connected with a coach who coaches pro fighters, and he works out of Fight Capital Gym.
Okay.
There's a lot of big name pro fighters that go there, and he donates his time. So once a month, Sunday at 4 p.m.
All right.
We usually try to announce it at least a month in advance, if not two. It's a free hour. Come learn.
Wow.
Come learn how to throw hands, defend yourself, and it's empowering. We've had a really hard time getting it off the ground because I just think that we haven't done the promos.
Right.
But,
right.
I can tell you there's 3 or 4 women that show up consistently every week. And I can see the change in them.
Right.
Not just from a physical standpoint, but a self-esteem.
Mm-hmm.
One of the girls, it keeps her off the streets. She shows up every month because she wants to be there. It is definitely a passion of mine that I would love to develop into something bigger.
Yes, yes,
But
because
yeah,
yes,
we donate our time, and he donates his time, and Fight Capital Gym also donates their space.
that's beautiful. I was about to say pretty soon they're going to be like, we need more days because when it's that good, they're going to need more days. Yeah, you got to feed the beast. Once you feed it, you got to keep feeding it more.
And it's an awesome environment too, because
I
Fight
bet.
Capital Gym. I mean, these guys. This is where Canelo trained. This is where Canelo
Okay.
came from. These guys, the owner is Skipper Kelp. I
Okay.
don't know if you've heard of
Okay.
him, but
Yes.
he's like
Yes.
Dana White's best friend. These are big names coming out of here, and
Right.
you'll never feel that in there. It's a
And
family environment.
you're checking all the boxes off that the community really needs. And I'm glad we have you. Definitely. I want you to give the audience your address of the location of the facility and also social media handles.
Yeah, absolutely. So our address is 3201. Actually, why don't you tell them?
Our location is 3201 South
Okay.
Maryland Parkway. We are on the third floor, Suite 314, Las
Okay.
Vegas, Nevada, zip code 89109. We're right across the street from Sunrise Hospital,
Okay. All right.
Maryland and Desert.
All
Our
right.
phone number is 702-202-3663. You guys can, if it makes it easier, they can always give us a call, to get more info, to get the exact location. Sometimes our patients do get a little bit lost, but yeah, we're right, Maryland Parkway and Desert Inn. And then our social media is Good Samaritan LV.
Yes.
So it's Facebook and Instagram. So you guys can, follow our page and get those updates for our woman self-defense class every month. And then you can keep up with Dr. Jang's reels.
Yes, yes. He's very active, you guys, on the reels. Go follow them. Again, that's Good Samaritan LV, as in Las Vegas. Follow him on Instagram. He's on there. He does great content creation with the reels there in the office. And of those, I know you guys are like, I don't like searching. Don't worry. I took care of you in the show notes. You can go directly there. You can actually go to his website also. Website is goodsamaritanlv.com. I have that in the show notes right there. You can directly go to the social media handles and the website also. You guys, I appreciate your time. Real quick before we go, we're going to find out what you like, either this or that, and then we're going to see how very, very Vegas you are. And since I have both of you guys, I guess you guys could swap off. We're going to let Caroline, you're going to go first. Carolina, you're going to go first for this or that. We're going to see this or that, okay? So on the first one in the morning, do you prefer Dunkin' Donuts coffee or Dutch Brothers?
Dutch Brothers.
Dutch Brothers, yes. Figured I knew one of you guys was going to say that. And you have to be in Las Vegas to know that. That's why I didn't put the Starbucks in there. I love the Dutch Brothers. And I like their little juices too. They have the little different juices. Real good. All right. So, Doc, let's get to you, Doc.
All
All
right.
right. So, we're going to get junk food. Junk food, baby. So when you're in the junk food mood, late night junk food mood, Taco Bell or Del Taco?
Taco Bell all day.
Yeah. What's your favorite menu item?
I get one thing: Crunchy Taco Supremes. It is my weakness.
Yeah. Oh.
Crunchy Taco Supremes. And as a physician, I feel somewhat self-conscious telling everybody I love Taco Bell. It is my guilty pleasure, that Crunchy Taco Supreme.
That's right. I love it. All right, Carolina. So with you now, with the quick getaway, thinking about Vegas, if you want to stay home for a quick getaway, would you prefer to go to Lake Las Vegas or Red Rock?
Red Rock.
Red Rock? Okay. Red Rock. Yes. Yeah. So you guys like both, right? I love Lake Las Vegas, but I love Red Rock too. It's just a breathtaking sight when you go to Red Rock. All right, so next we're gonna see how very, very Vegas you guys are. I'll let you guys, compare what the answers are. And I want to give shouts out to ofac.com. That's ofac.com for this one. Now, which singer, before passing away, planned to build a 50-foot robot of themselves that would roam Nevada desert? I'm going to give you 3 options. Which singer, before passing away, planned to build a 50-foot robot of themselves that would roam the Nevada desert? Was it Prince, great sign, Michael Jackson, or Frank Sinatra?
Prince.
What you think? Prince? Okay, I thought that too, but it was actually Mike Jack. And yes, he wanted it to actually moonwalk around it. This was in 2009.
Go with Mike first because I was like, he's got that delusion.
Right.
Prince is a little bit more humble, but
oh man, so that's
amazing music.
Yes, man. I appreciate you guys. Again, we have Dr. Shaun Jang and the company president, Carolina Chavez. And this is Good Samaritan LV. You guys, in the show notes, we have their social media handles. Also, we have the website. You guys want to give any last words or anything you want to say before we head out?
Come visit us. Come. Any questions, just go ahead. Don't hesitate. I promise you we'll answer your questions. And if we can, we'll find your answers. So just, give us a call, schedule an appointment. And if there's any more information, again, our phone number is 702-202-3663.
Yes, and everything is in the show notes. Doc, Carolina, I would definitely be seeing you guys. I would see you guys on the record and off the record. Now I'm hearing everything. So definitely I'll be through you guys, and you guys will see me there. For those that are watching and following, I will be there at the doc to check them out. I want to thank you guys again for joining us tonight, okay?
Thank you.
Thanks for the opportunity, and thanks for helping us get that word out.
Anytime. Las Vegas, thank you guys for listening. Of course, and all you guys around the world, I know you guys are tuning in. I want to thank you for your support. Thank you. Next Friday. I'll see you guys next Friday. Other than that, you guys enjoy your lunch. Good night, and have a good weekend. Love you guys.
All right, Kyle.